Sexual dysfunction is a topic that a lot of people don't want to talk about, and a lot of clinicians don't even want to ask about. So let's talk about it. Hey, I'm Dr. McCleary, and I'm a licensed clinical psychologist and Navy veteran. And you may notice that neither one of those were a urologist. So I won't be focusing on the physiology of the male penis. Yes, I said penis. Or the subsequent medication treatments for sexual dysfunction. What I will be focusing on is the possible relationships between sexual dysfunction and PTSD. You heard me say penis, and now I'm going to say vagina. Yes, I said vagina. For this video, we're going to focus on male veterans. And the reason for that is not because women do not suffer from sexual dysfunction. That is not true at all. The reason for that is that the majority of the research that has been conducted already, especially on veterans, has been with male cohorts. So for the sake of this video, we're just going to talk about the fellas. There are many causes and factors that influence sexual dysfunction. Depression, anxiety, PTSD, recent surgeries, age, diet, high blood pressure, substance use, alcohol use, the list goes on and on. But what I want to be clear about is that if you are suffering from sexual dysfunction, you are not alone. And what I want to encourage you to do is talk to somebody about it. Male sexual dysfunction can look very differently from person to person, but it's often split into three different categories: decreased libido, erectile dysfunction, and ejaculation problems. Decreased libido applies to reduction or lack of interest in sexual activity. Erectile dysfunction applies to difficulty maintaining or achieving an erection. Ejaculation problems apply to individuals that have trouble ejaculating or inability ejaculating, or individuals that ejaculate before they want to. Multiple studies have looked at the correlations between PTSD and sexual dysfunction. And what they found is with male veterans that have PTSD, they're more likely to have sexual dysfunction than male veterans that don't have PTSD. Anger and irritability are common symptoms of PTSD. And anger and irritability have been found to be correlated to difficulties with intimacy. And this makes sense. Difficulties trusting, difficulties controlling your anger make it often hard to be intimate with someone else or even yourself. Many symptoms of PTSD are correlated to relationship difficulties. So not just the increased irritability or anger, but the decrease in the ability to love or experience positive feelings. Maybe not wanting to go certain places, so not wanting to go on certain dates. Difficulty sleeping. All these types of things can put a lot of strain on a relationship. And strain on a relationship is one of the biggest factors regarding sexual dysfunction. Sometimes an individual's fight or flight response goes off when they didn't intend it. So for some people, the idea that sexual activity is going to occur, or even during sexual activity, their fight or flight response can go off. And the fight or flight response does many things. But one thing that it does is regulate your blood flow. It sends blood to the things that you may need, to your extremities, because you may need to fight, or you may need to run. But you know where it doesn't send blood to? Yeah, the place where you want it during that time. If you're experiencing sexual dysfunction and have PTSD, I want you to know that you're not alone. This is very common. And I want to encourage you to talk to your physician, talk to your clinician, talk to the person that you feel comfortable discussing these issues with, or maybe even the person that you don't feel that comfortable but are willing to have the conversation. Because PTSD and sexual dysfunction are both things that can be treated, but they can't be treated if you don't talk about them. If you're a clinician watching this video, I encourage you to ask your patients, ask your clients about this. Ask them about sex. Ask them about possible sexual dysfunctions, so you're able to normalize this. And so you can develop a relationship and create an environment to where somebody is actually comfortable talking about these very difficult things. I'm not saying that a urologist needs to be a psychologist, and I'm not saying a psychologist needs to be a urologist. What I am saying is that as clinicians, we all have a responsibility to ask the hard questions. Something to think about. If this video was helpful for you, go ahead and press that like button. And if you want to learn more about PTSD, think about subscribing to my channel. But more important than that, if this video was helpful for you, that means that it can probably be helpful for another veteran. So before you subscribe or like my page, I ask you to share it with someone else. Because at the end of the day, that's really what all of this is about. One veteran trying to help another.